So coming to the histology of respiratory system, under the histology of respiratory system, we will learn about trachea and next one is lung. Trachea and lung are the important slides in the histology of respiratory system. Coming to the trachea, the lining epithelium of the respiratory mucosa, it is nothing but pseudostratified ciliated columnar epithelium. So the lining epithelium of the respiratory mucosa is pseudostratified ciliated columnar epithelium. The lining epithelium is pseudostratified ciliated columnar epithelium. That means the cells are arranged at different levels. The cells are of different shapes. So the cells are different levels. So it looks like more than one layer of cells are present. But only one layer of cells are present, but the cells are of different shape. Along with pseudostratified ciliated columnar epithelial cells, we can see some goblet cells also. Cells also. Pseudostratified ciliated columnar epithelial cells. So the lining epithelium of trachea is pseudostratified. Pseudo means false, right? So the lining epithelium of trachea is pseudostratified ciliated columnar epithelium. So along with the pseudostratified ciliated columnar epithelial cells, we will able to see some goblet cells also. Goblet cells are also seen along with the pseudostratified ciliated columnar epithelium. What is the function of coelom is they throw away the dust particles. Thus the continuous action of the cilia, cilia continuously beat and they throw away the dust particles. That is the function of the cilia. Along with the pseudostratified ciliated columnar cells, we will able to see some goblet cells which secrete mucus. So, and along with that, we can see some non-ciliated columnar cells also. They secrete amylase enzyme. They consist of some villi. Non-ciliated cells are also seen along with the pseudostratified ciliated columnar cells. Though, because the cells are at different shapes. Look here. So the cells are single layered but are of different shapes and the nucleus is arranged at different levels because it looks like more than one layer of cell is present, but the cells are only single layered but of different shapes. So the nucleus is present at different levels. That's why it is pseudostratified in appearance. So the epithelium of the trachea is pseudostratified ciliated columnar epithelium. We know that trachea is made up of 15 to 20 C-shaped cartilaginous rings. The cartilage is made up of hyaline cartilage. On the posterior aspect, it is made up of C-shaped cartilaginous rings, right? The trachea is made up of C-shaped cartilaginous rings. Yes. Trachea is made up of C-shaped cartilaginous, 15 to 20 C-shaped cartilaginous rings are there, and on the posterior aspect of the C-shaped cartilage, we have smooth muscle is here, that is called trachealis muscle. On the posterior aspect of the tracheal ring, we have one smooth muscle is here because of that muscle we call it as trachealis muscle because behind the trachea we have esophagus. So in order to avoid any damage to the esophagus, the posterior aspect of the trachea consists of smooth muscle called trachealis. So the cartilage of the tracheal rings is made up of hyaline cartilage. Okay, so this is the epithelium of the trachea, which is nothing but pseudostratified ciliated columnar epithelium, and beneath the epithelium we have subepithelial connective tissue, consists of some lymphocytes, fibroblast cells, and in the lamina propria, beneath the subepithelial connective tissue, in the lamina propria, we will able to see both number of serous acini. Serous glands are seen. So, we will able to see more number of serous acini. And also a very few mucous acini can also seen here. So, what is the structure of serous acini? So, the cells are, a very small lumen is present in the serous acini, and the cells are pyramidal in shape or triangle shape of cells are present, and the nucleus is round and situated at the base, and the apex of the cell consists of more number of zymogen granules. Small lumen is present, pyramidal shaped cells are seen, and the nucleus is round or oval and it is situated at the base, and the apex of the cell consists of more number of zymogen granules. That is the structure of serous acini. So, coming to the mucous acini structure, very large lumen is seen, and the cells are cuboidal in shape. Okay, and the nucleus is flattened and situated at the base. Because of the presence of mucigen granules, the nucleus, it is thrown to one side to the bottom and it is flattened. That is the structure of mucous acini. So in the lamina propria of the, this is the lamina propria. In the lamina propria, we will able to see serous acini as well as serous glands as well as mucous glands. Serous glands and very few mucous glands are also seen. Very few mucous glands are also seen in the lamina propria of the trachea. So, this is the epithelium. This is the epithelium. Is subepithelial connective tissue. Subepithelial connective tissue, and beneath that we have lamina propria, and beneath that we have hyaline cartilage is there. We have hyaline cartilage in the, because the trachea is made up of 15 to 20 cartilaginous rings which is made up of hyaline cartilage. So, one plate of hyaline cartilage are seen. So, these plates of hyaline cartilage made up of, the hyaline cartilage is made up of chondrocytes. They are D-shaped chondrocytes are seen. They are arranged in groups. So the chondrocytes are arranged in groups in the hyaline cartilage. So because of these chondrocytes are arranged in groups, we call them as isogenous groups of chondrocytes are seen. Isogenous groups of chondrocytes. The chondrocytes, they are arranged in groups in the hyaline cartilage. We call them as isogenous group of chondrocytes. They are arranged in 3 to 4 numbers. Okay. So isogenous group of chondrocytes, they are in the matrix made up of some collagen fibers. They are in the matrix made up of some collagen fibers. And in the hyaline cartilage, we can't see the collagen fibers, suppose because the refractive index of the matrix is same that of the collagen fibers. So in the hyaline cartilage, we can't see the collagen fibers. Okay, in the hyaline cartilage, we can't see the collagen fibers because the refractive index of the matrix is same that of the collagen fibers, and that way the hyaline cartilage looks translucent in appearance. Okay, glass-like appearance is seen in the hyaline cartilage. So, first is the pseudostratified ciliated columnar epithelium, and beneath that we have subepithelial connective tissue. In the subepithelial connective tissue, we will be able to see some lymphocytes, fibroblasts, macrophages are seen. And beneath that we have lamina propria. Lamina propria consists of serous acini as well as mucous acini. Serous glands secrete amylase enzyme depending upon the presence of granules, basophilic granules or eosinophilic granules. And coming to the and beneath the serous acini and mucous acini, we will able to see plate of cartilage. That is, isogenous groups of chondrocytes are the place of hyaline cartilage is seen. This is the hyaline cartilage. This is the perichondrium. Hyaline cartilage, it is covered by perichondrium, right? So this is called perichondrium. Beneath the perichondrium, we have flattened cells are seen. These we call it as fibroblast cells. Fibroblast cells. And these fibroblast cells, they mature and they form chondrocytes. Okay, we can call them as chondroblast cells also. These chondroblast cells or fibroblast cells, they get matured and they form chondrocytes. So, what is the characteristic feature of a hyaline cartilage means the cartilage, they are chondrocytes, they are arranged in groups in the matrix. These groups we call them as isogenous groups of chondrocytes. So, a plate of hyaline cartilage is seen in the trachea, and beneath that we have fibrous tissue is there, and beneath that some made up of some fibroblasts, cells, macrophages as well as blood cells are seen. So this is about the trachea. So the trachea, it is lined by pseudostratified ciliated columnar epithelium, and here along with the pseudostratified ciliated columnar epithelial cells we can see some goblet cells also which secrete mucus. And why it is called pseudostratified ciliated columnar epithelium means the cells are of different sizes. That's why the nucleus is placed at different levels, which gives the epithelium a pseudostratified in appearance. That's why we call it as pseudostratified ciliated columnar epithelium. And beneath that we have subepithelial connective tissues there, and beneath that in the lamina propria, see this is the lamina propria. So this is the lamina propria. We can see the serous glands as well as mucous glands, and beneath that we have hyaline cartilage is there. Hyaline cartilage, it is because trachea is made up of hyaline cartilaginous rings. We can see isogenous groups of chondrocytes, perichondrium, and the hyaline cartilage is made up of collagen fibers, but we cannot see the collagen fibers because the refractive index of the matrix is same that of the collagen fibers, and beneath that we have some adventitia is there. Adventitia layer is there, some fibrous fatty tissue, some fibrous fatty tissue, some blood vessels, macrophages are seen, and some reticular fibers are also seen here in the adventitia. So that's about the trachea slide. And coming to the lung. So the trachea, it divides into the trachea. It divides into two principal bronchi. Again, these principal bronchi again divides into segmental bronchi, and this segmental bronchi again divides into tertiary bronchi, and again they divide into lobar bronchiole, and each lobe of lung is supplied by lobar bronchiole. These lobar bronchioles again and again divides into tertiary bronchi, and again tertiary bronchi again divides into respiratory bronchiole. So from principal bronchi divides into segmental bronchi, segmental bronchi again divides into tertiary bronchi, again divides into lobar bronchiole. Divides into bronchioles. In these bronchioles, they enter into the each lobe of the lung as lobar bronchioles. These lobar bronchioles, they further divide to give it to terminal bronchioles. These terminal bronchioles further divide into respiratory bronchioles. These respiratory bronchioles further divide into alveolar duct, alveolar sac, atrium, and alveolar sac. Segmental bronchi into here tertiary bronchi. So the principal bronchi here divides into segmental bronchi. The segmental bronchi again divides into tertiary bronchi. The tertiary bronchi again divides into bronchioles, and each bronchiole enters into the each lobe of the lung as lobar bronchiole. Again this lobar bronchiole further divides into terminal bronchiole, and this terminal bronchiole further again divides into respiratory bronchiole. Up to this principal bronchi, segmental bronchi, tertiary bronchi, bronchioles, lobar bronchioles, terminal bronchioles. Up to this, we call it as conducting system of passage. Up to this, up to the respiratory bronchioles, we call it as conducting system of passage. Conducting system of passage. Here they only they only allow the gas to pass. Conducting system of passage. Here no exchange of gases takes place. From respiratory bronchiole, what happens? The exchange of gases takes place because the respiratory bronchioles, they further divides into alveolar ducts, alveolar atrium, and alveolar sac. Here exchange of gases takes place, and now this part we call it as exchange of respiratory system of passage. Conducting system of passage, and it is nothing but respiratory system of passage where exchange of gases takes place. Exchange of gases takes place. Okay, so the principal bronchi divides into segmental bronchi. Segmental bronchi further divide into tertiary bronchi. Again tertiary bronchi further and divides into bronchioles. Each enters into the each lobe of the lung and lobar bronchioles. Again lobar bronchioles divides into terminal bronchioles. Again terminal bronchioles further divide into respiratory bronchioles. Up to this is the conducting system of passage. It allows the gases to pass through, and from the respiratory bronchiole we have alveolar duct, atrium, and alveolar sac, where alveoli are present. To the alveolar sac, alveoli are attached. Alveoli are attached through which exchange of gases takes place. This is the respiratory system of passage where exchange of gases takes place, and this is the conducting system of passage where conduction of gases takes place. So that's about the brief structure, brief introduction to the passage, how the passage of gases takes place and how exchange of gases takes place. Coming to the slide, lung slide. We know that the trachea divides into principal bronchi, and the principal bronchi divides into no number of bronchi or bronchioles. So what happens here is, what is the epithelium in trachea? It is the pseudostratified ciliated columnar epithelium. What happens is, when the trachea starts dividing, the epithelium starts reducing from pseudostratified epithelium to ciliated epithelium, some ciliated epithelium to columnar epithelium, columnar epithelium to cuboidal epithelium. So as the bronchi divides on, what happens is the epithelium also changes from pseudostratified to ciliated, ciliated to columnar, columnar to cuboidal, and finally in the alveolar sac we will see the flattened epithelium. So the epithelium, it completely decreases in size, as well as what happens is the cartilage Cartilage also, it also decreases when the principal bronchi starts dividing and the smooth muscle increases. So cartilage also decreases and the smooth muscle increases. So when we take the trachea, slide, a bronchi structure is seen. For any bronchi structure we can take. We can see the epithelial cells. Here we know that the epithelial cells, they decrease in size. Here we can draw ciliated columnar epithelium, or also we can draw pseudostratified ciliated columnar epithelium also we can draw, no problem. But the epithelium cells are decrease in size as the bronchi starts dividing. Okay, and beneath the epithelium we know that the epithelial connective tissue is there, which consists of some fibroblasts, macrophages, some lymphocytes, everything is there, and also some serous acini can also be seen. Serous acini as well as mucous acini are also seen. And here is what happens as the bronchi starts dividing. What happens here is the cartilaginous nature decreases and the smooth muscle nature increases. So the cartilage is not continuous. The cartilage, it is present at plates because as the smooth because at the because the smooth muscle nature increases, here what happens is the cartilaginous nature decreases. So we can see the plates of hyaline cartilage here. You can see the plates of hyaline cartilage, not a continuous plate of hyaline cartilage, and we can see some smooth muscle fibers also here. Because the smooth muscle fibers are spindle shaped cells, right? The spindle shaped cell, because we can see some smooth muscle fibers also. Here the nucleus of smooth muscle is oval and elongated. So that is the structure of one bronchi, and we can see the structure of alveoli also. The alveoli, they are lined by nothing but flattened epithelium. The alveoli, they are lined by flattened epithelium. Okay, so that is the structure of alveoli, where exchange of gases takes place. So see here, the alveoli, they are lined by flattened epithelium. And here is the blood vessels. Do you know that the blood vessels, they are also lined by flattened epithelium, nothing but endothelium, right? In between the epithelium of the alveoli and the blood vessels, here is the epithelium of alveoli. This is the epithelium of blood capillary. Okay. Here what happens is some connective tissue is there. So in the connective tissue, what happens is exchange of gases takes place from the alveoli, and here from the epithelium of blood vessels we have what happens is exchange of gases takes place. This is called blood alveolar barrier. Blood alveolar barrier, in the capillary alveolar barrier we can call it as capillary alveolar barrier. Here what happens is the capillary, what is the structure of blood alveolar barrier is epithelium cells of the alveoli and some connective tissue and the endothelial cells of the blood vessels. So here exchange of gases takes place. Okay, the blood vessels comes in contact, the blood capillaries comes in contact with the alveoli, where exchange of gases takes place. So that is the structure of alveoli. So in the lung we can see some bronchial structures, whether it may be segmental bronchi or it may be tertiary bronchi. Bronchial structure is there. As the epithelium, as the bronchi starts dividing, what happens is the epithelium undergo reducing. So from the pseudostratified to ciliated, from ciliated to columnar, columnar to cuboidal, and finally to the alveoli, it is flattened epithelium. Nothing but squamous epithelium. So the epithelium is ciliated columnar, and also some epithelial connective tissue is there, some mucus and serous acini are seen, and along with we can see plates of hyaline cartilage are seen. Because continuous hyaline cartilage can't be seen, because as the bronchi starts dividing, what happens is the hyaline cartilage decreases and the smooth muscle lesion increases. Okay, so the plates of hyaline cartilage is seen, and here are the some smooth muscle fibers are also seen. This is the plates of hyaline cartilage. Ciliated columnar epithelium. Subserous acini as well as mucous acini are seen. Subserous acini as well as mucous acini, place of hyaline cartilage. These are nothing but the alveoli lined by flattened squamous epithelium. Okay, and this is the atrium, which is nothing but the passage. So this is the blood capillary barrier, blood alveolar barrier. So that's about the lung. That is the histology of respiratory system. మధ్యలో 2 సార్లు కాఫ్ వచ్చినాయి, పక్కకు వచ్చి లగ్గేనా ఎడిట్ చేసేయండి. సరేనా?